but is making it easier to shoot up the answer. Joining us now is Destinie Campanella. She sits on the board of Savage Sisters Recovery, a Philadelphia-based nonprofit that provides resources for those affected by substance use disorder and supports a harm reduction approach to all of this. Destinie, great to have you here. I'm sure I don't need to tell you, Kensington is ground zero for the opioid crisis in Philadelphia. It's home to the largest open-air drug market on the East Coast. The new mayor says organizations like yours, which offer harm reduction, are making things worse. I want to give you a chance to respond.
Yeah, so I first would like to say that I've been a harm reduction advocate for about 10 years in Philadelphia. I'm born and raised in South Philly, where I still currently live. I've been doing work in Kensington for about 8 years now. I've been doing harm reduction work in a multitude of different platforms. Like I said, I do sit on the board of Savage Sisters as well. I first would like to address that. I calling it Zombieland is very stigmatizing language. The individuals we serve, they are not zombies; they are humans, and individuals who consume substances like xylazine, who causes really, heavy sedating effects. They are victims of the criminal drug market. They are not zombies. These are
Okay,
humans.
but let's call them people who are addicted to drugs, who are clearly in and out of states of consciousness, all up and down the street. We're looking at video of it right now. I just want to get your response to the fact that the mayor of Philadelphia, who just took office, says organizations like yours are making it worse.
Well, I'm not the founder of Savage Sisters. I'm a harm reduction advocate. Harm reduction advocates have not been making it worse. This is a crisis that's been around. I'm going to be 34 years old. This has been around way before I was even born. I was present 6 years ago for the eviction of the 4 main encampments underneath the bridge located in Kensington. And what happened was 6 years ago, there was not the proper resources to follow these individuals into the community. And we're seeing that happen again. So obviously, I'm a harm reductionist. I may have different views and perspective, but this is unsustainable for people who use drugs, and this is unsustainable for the residential community because we don't see the proper resources in place before we have encampment sweeps.
All right, well, the city says it has tried harm reduction for several years. It allocated millions of tax dollars to safe injection sites, and the number of overdose deaths only rose. The Department of Health says the highest numbers of overdose deaths happened right near the safe injection sites. How can you say that's helping?
We don't have a safe injection site in Philadelphia.
Okay, but the Philadelphia, obviously at some point you did, because
no, we didn't. We never had it. Philadelphia has never had an overdose prevention site.
So when the Philadelphia Department of Health says that the highest numbers of overdose deaths happened right around the zones of these harm reduction and safe drug use areas, these areas that are set up for people to come get high safely, you're saying that those don't exist, even though the city's been giving millions of dollars to it?
We do not have a safe injection site or overdose prevention center, no.
Okay, we should definitely get on the phone with the Philadelphia Department of Health because they've been giving millions of dollars to somebody else then. But I'm just curious about your argument that harm reduction works. Overdose deaths are at record highs in Philadelphia. How is harm reduction working?
Well, overdoses are to record high because we have a very poisonous and tainted drug supply. Like you previously stated, fentanyl is the driver of our deaths, as well as other substances like xylazine. That is why overdoses are increasing significantly, is because our very poisonous and tainted drug supply.
So are you concerned that the tide seems to be turning not just in Philadelphia, but across the country? Oregon just abandoned its attempt at harm reduction by recriminalizing drugs. San Francisco's Mayor London Breed is cracking down. She says, quote, harm reduction doesn't work. It's making it worse. The new mayor of Philadelphia now says users who refuse to go to treatment will be arrested and sent to jail. She's also closed a harm reduction center and cut city funding to the needle exchange program, saying, quote, we must stop incentivizing people to do the very thing we want them to stop doing.
Yeah, well, you can't eliminate drug use. That's not a thing. There's plenty of data and evidence that supports abstinence-based or just say no has not been effective. It's not working. We've seen the same thing happen when people have tried to ban alcohol many, many years ago. People are going to use drugs. We are just trying to make it more safe. There's no such thing as safe, right? There's no such thing as you're going to do anything. So
how are you making it more safe?
We do some. I think you might have been referring to. We don't have safe injection sites or overdose prevention centers. There is syringe exchange, which is different.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.